Hi everyone, Dr. Nandi. Hope you're having a great day. Thank you for joining me today on this live, talking to you about your vision. And lots of us, talk about this vision as you get older, right? People wear those cheaters and the glasses, and what happens to your eyes over time, and what can we do about them, if anything, right? So we're talking about that today. Thank you for joining me on at least for us, it's a pretty dark Tuesday here in Michigan. But we're talking about your eyes and what can you do, right? The effects of aging on your eyes. How can we affect this? How can we improve it in simple ways? Again, let us know where you're joining us from. If you have any questions, or and we'd love to be able to get as many questions as we can. So we'd love to be able to answer them. Again, I'm Dr. Partha Nandi, and thank you for joining me. So, the effects of age, right? We talk about, how your age changes you, and people think about wrinkles and gray hair and your knees and joints affecting you. But as your body ages, so will your eyesight. And we know this. So as your problems occur with your eyesight, it can interfere. Why do we care about this? It can interfere with everyday activities. A lot of people at work can't see the screen well, or they can't read well. So this is why it's important. That's why we're talking about this. You can have trouble distinguishing colors. You can have problems distinguishing between blue and black. It takes more time for your eyes to adjust to changing levels of light. You take your phone, and you have to, in the dark, you have to keep increasing the brightness, right? These are some signs that your eyes may be getting affected with age, right? It may take time for your eyes to adjust between dark and bright settings, and you'll need more light to see well. And Michelle Toole says, "What can I take to improve my vision?" And that's what we're talking about today. Please, thank you for joining us, and stay tuned. And you may develop headaches, tired eyes while reading or doing other close up activities. So there's growing evidence that, changing your eyesight changing can affect your mobility issues and injuries, depression, anxiety, cognitive decline, meaning the way you think, the way you perceive things, shorten life expectancy, even if your vision is not working. So what happens to your vision as you age? Now, your eyes experience physical changes over time that can affect their proper function. What are some examples? Loss of flexibility in your lens, impacting its ability to switch from near to far focus, lens discoloration, right? And how it processes light, reduced strength in the muscle that controls your pupil size, your pupils that let in light, and it lowers the tear production, all the tears that come through. On average, these changes begin around age 40. Now, it's dependent on the individual, and it can impact your eyes' focusing ability, which is a natural progression, and it's called presbyopia, Presbyopia. And the most common effect is experiencing more difficulty in seeing clearly nearby objects, right? Especially in dimmer lighting. Studies found that 1 in 28 Americans over the age of 40 experiences age-related vision loss. And this is expected to double by 2050. Again, those of you joining us, I'm talking about vision loss as we get older, and what can we do about them, right? People think, well, it's just I'm getting old, but can we change it? In the U.S., eye health is a major concern for those of folks who are over 60 years of age. And the eye is the most susceptible organ to what's called oxidative damage. Now, what is oxidative damage? It's caused by light toxins, including smoke, atmospheric oxygen, and abrasion, which is trauma. As ultraviolet, and you have blue light that passes through what's called your retina in the back of your eye to the photoreceptors, and there are things called the rods and cones, and the pigment and epithelial cells, reactive oxygen species. So these free radicals that can really damage the eyes are generated. If you don't have enough antioxidants available to neutralize these free radicals, what happens? The eye then undergoes excessive oxidative damage. Very important. Genetics and the natural aging process really play a huge role in long-term eye health. Now, but research shows that there are controllable factors that can help you, either lower your risk of visual impairment or slow its progress. And this is what Michelle was talking about. So, how do you keep your eyesight strong? Please hopefully take notes. Although you can't control your family history or of glaucoma, macular degeneration, these are some diseases that you may not be able to control. But there are certain lifestyle changes you can make to reduce your risk of developing eye conditions, making smart food choices, right? You want to have foods that are nutritious, supporting eye health. What are some examples? Leafy green vegetables like spinach, kale, and collard greens. Love salmon, tuna, and other oily fish that'll help your eye health, right? Good fats. Eggs, nuts, beans, and non-meat protein sources. Nuts are my go-to snacks. Oranges and other citrus fruits or juices. Oysters is another food if you love oysters. Remember, a well-balanced diet also helps you to stay at a healthy weight. And what does that do, right? That lowers your odds of obesity. And obesity and diabetes, which is related to that, type 2 diabetes especially, is the leading cause of blindness in adults in the US. So we're talking about type 2 diabetes, leading cause of blindness in adults. In my family, we've had folks that have lost their vision due to diabetes. And most studies find that overweight folks and obese people are far more likely to develop cataracts than people who weigh less. So very important. Barbara Miles just joined us and she said cataract surgery today. There's so many folks who get cataract surgery, right? And it's important because if you have cataracts, it can impair your vision. What else can you do besides having a well-balanced diet? Stop smoking, people. It makes you more likely to get cataracts, macular degeneration, damage to your optic nerve, amongst many other medical problems. Current and former smokers, and get this, have up to 4 times the risk of developing age-related macular degeneration. 4 times the risk, current and former smokers. The risk remains high even up to 20 years after quitting, so please don't start. For those of you who are watching, don't start. Researchers say that there are several reasons for the increased risk in smokers, including cellular changes on the microscopic level, oxidative stress, and what's called vascular constriction, where the blood vessels get constricted, not getting good supply. What else can you do? Besides eating smart, stopping smoking, right? You can also slip on those shades. You look cool, but the right pair of shades can also help you protect your eyes from the sun's ultraviolet rays. Too much UV exposure, UV is short for ultraviolet, too much UV exposure boosts your chances of cataracts. We don't need that. Just don't need that. And macular degeneration, and also increases the risk of age-related macular degeneration. Again, so too much UV exposure also can cause these problems. People with fair skin and blue eyes have a much higher risk of developing cataracts. In 1998, Johns Hopkins study was amongst the first to link sun exposure to increased risk of cataracts. So put those shades on. The increased UV light is actually thought to cause changes in the metabolism, right? How the cells actually operate in the retina and in the lens. Retina's in the back, lens is right here behind you. That helps you focus the light. Choose sunglasses, important to know this, that blocks 99 to 100% of UVA and UVB. Not just UVA, but check out, make sure it blocks 99 to 100% of UVA and UVB rays. And then you can have sunglasses, would be great to have wraparound lenses that protect your eyes also from the side, right? Johns Hopkins study again found that up to 20% of the sun's rays can leak in through the sides of the typical glasses. Important to know that, right? It can come in through the sides, so it's still damaging you. Now, we talked about having smart food choices, stopping smoking, don't even start smoking, slip on the shades. What else can you do? Give your eyes a rest. This is something I suffer from. Look away from the computer screen, right? Don't keep looking at it. Or one of these suckers, right? You're looking at the screen all day long. Try not to look at those screens. Staring at a computer or phone screen far too long can do what? It can cause eye strain, blurry vision, trouble focusing at a distance, dry eyes, headaches. So it's really important to do this. Take a break every 20 minutes to look about 20 feet away for 20 seconds. You got a lot of 20s here. take a break every 20 minutes to look about 20 feet away for 20 seconds. Very important, right? And lastly, and this is Michelle's talking about this, can some vision loss be attributed to chronic disease? Absolutely. We talked about diabetes, MS, autoimmune disease can also be contributing. Remember to manage your health conditions to minimize risk. According to a study from the Centers for Disease Control and Prevention, the CDC, poor health is a known association of chronic conditions and older people with vision impairment. Certain health conditions can affect your health. Big ones, high blood pressure, heart disease. Got to get them controlled. Hello to Laura. Thank you, Laura, from Farmington Hills, Michigan. Thank you for joining us. And let us know where you're joining us from. If you think this is useful, share this with your community. We'd love to talk about this. So besides, we talked about having optimal dietary choices, stopping smoking, putting on those shades, give your eyes a rest, look away from the computer screen, right? Talk about managing your health conditions. What else can you do? What about supplements? So we developed Dr. Nandi's Imax, and I'll put up this picture so you can see what it looks like. So this is Imax. And this product has really helped my wife tremendously. So, she was having some difficulty with reading before. And then I saw her reading some fine print without any struggles. And when she started taking this Imax was really an important change in her vision. And it was pretty dramatic and, something that I frankly didn't expect to work as quickly as it, but it did. And now she doesn't have to hunt down readers every time she wants to read something, right?
Yeah, I just thought I'd come in because this product has completely changed my life. I am so excited because I'll be honest with you, I just felt too young and too fashionable, I'll say it, to be running around looking for glasses all the time. So honestly, this product has completely helped me so much we went out of town last week and I would not leave home without it. So
yeah, she didn't.
Came in to share
she
that.
didn't. And it's important to know this, that, we want to develop products that really, first of all, was as plant-based as possible and also effective. So wanted to be able to look at the science of any product that we make, and Imax is no exception, right? iHealth, we formulated it with a specific blend of botanicals, nutrients, antioxidants, and minerals, and they've been shown in research to support healthy iron function. And I'll talk about this, and I'll have my staff, any of my staff, to put up the link if you're interested in getting that. Kelly and I always want to be able to help you. We'll give you 10% off your first order. So we would love for you to be able to try it, make it easy if we can. So 10% off your first order. We'll put the link up so you can, if you think this is something that's useful for you, then you can get it. Hello to Brenda from Novi, Michigan. Marianne says, mycoplasma can hurt the eyes. Absolutely. Thank you for joining us. And listen, I'll tell you that iHealth, again, formulated to provide key antioxidant support. Remember, I talked about those free radicals that are formed that can damage your eyes. What we wanted to do is have a formula with Imax that supported key antioxidant support, alpha lipoic acid, ALPHA, alpha lipoic acid, very potent, very powerful, versatile antioxidant that's both water and fat soluble. Now, ALA, which is the alpha lipoic acid for short, what does it do? It helps to inhibit something called aldose reductase, which prevents sorbitol-induced leakage of important antioxidants from eye tissues and recharges vitamin C, vitamin E, and glutathione. So in Russia, it's used clinically, and animal studies have shown that ALA has the potential to reach high concentrations and be protective to the ocular lens of rats. So there's research that supports it. And recent research has shown that lipoic acid increases insulin-stimulated glucose disposal, both in the body and the skeletal muscle, helping to promote healthy blood sugar levels. And then that helps what? Your vision. Also, research has shown that a dose of ALA of 600 milligrams per day over 3 months helped promote healthy blood fats by 36% and provided key antioxidant support. All these are helping for having the eye not to be exposed as many toxins, right? ALA has been shown to also increase another pathway called the GLUT4 pathway, which is a primary passageway for glucose to enter the cells and be used for metabolic energy. So again, important. What about ginkgo biloba? Many of you may have heard about this, but ginkgo biloba extract is a well-studied botanical that increases what are called cerebral blood flow and protects neurons from a variety of conditions and oxidant-induced damage. Again, this is about your body getting ravaged by oxidation and things that are toxins, right? So you want to be able to have as much protection from that. So ginkgo biloba scavenges NOS, or nitric oxide species, and ROS, reactive oxygen species, and it supports the powerhouse in our cells, mitochondrial function, inhibits what's called NMDA receptor reactivation, and also helps to stimulate the release of NOS to support cerebral blood flow. Again, very important key antioxidant support for eyes. So it helps this ginkgo biloba helps mitochondrial function, inhibits NMDA receptor activation. So all these fancy words, again, to really support antioxidant support for your eyes. And then we have carotenoids, which are lutein, lycopene, and zeaxanthin. So zeaxanthin, I'll spell it for you, zeaxanthin. Now, these are carotenoid pigments whose role in eye health very well established from studies. And what it shows that there are high levels of this lutein and zeaxanthin in eye tissues, and it helps eye function and visual acuity, which is what you want. You want the vision to be improved and sharp, and that's what we want. Instead of trying to say that, hey, this is all we can do. Here's something that's going to help you to be able to preserve your eye vision. And then increased dietary intake of carotenoids, especially lutein and zeaxanthin, protects the eye from oxidative stress. In fact, a study showing 145 patients divided into a placebo group and 2 groups given capsules of lutein, zeaxanthin, DHA, and EPA found that over 12 months, the supplements significantly improved plasma antioxidant capacity, again, to help decrease toxins, right? As you age, as your body has age-related eye deterioration, this can help with that. So circulating macular xanthophyll levels and optical density of the macular pigment. So bottom line, it helps your body to be able to fight some of the poisons, increase the antioxidant activity. What about zinc? I've talked about zinc in many other ways, right? It's a vital coenzyme for eye tissue. Zinc is a super necessary component for antioxidant enzymes, including what's called superoxide dismutase, glutathione peroxidase, and catalase. Studies with monkeys showed that oxidative stress retinas show a 60% reduction in the activity of catalase and glutathione peroxidase, and as well as a 4-fold reduction in zinc concentration. So the zinc will help you to be able to be a coenzyme, kind of a helper to be able to get antioxidant enzymes to work effectively. And bilberry extract, this contains a high amount of antioxidants, and it's similar to that what's found in grape seeds. Again, we want to be able to go to nature to find some of these products. And bilberry has a long history of use in eye health. Its activities include inhibition of aldose reductase and improving the capillary permeability, which means that it again helps you to be able to protect the eye. And bilberry, again, it's like a broken record, has been shown to protect against an oxidative stress-induced immune response in animal models. And the extract for bilberry has also been shown to support renewal and homeostasis of the corneal cells. Remember, the cornea is the outermost layer. Again, I'll have my my staff here, my team put up the link in case you're interested in looking at this, the Imax product, and I'll put it up if you want to see what it looks like if you go to our website. And I'll keep going. What else does Imax have? Quercetin. That's a flavonoid found in a variety of herbs, vegetables, and fruits. Again, keeping that whole plant-based botanical nature of what we're offering. And quercetin provides key antioxidant support for the eyes. What about taurine? Taurine concentration is high in the retina and is required for retinal tissue growth. It's been shown to protect rod outer segments from oxidative damage. Remember, the rods and cones in your eyes are very important. And taurine has been shown to protect rod outer segments from oxidative damage. Again, damage from all the stuff that can really cause your vision to decrease, and to protect lens tissue from radiation. Researchers have actually suggested possible functions for taurine in the retina, including protection of what's called a photoreceptor, regulation of transport, and regulation of signal transduction. So all this is good stuff to help protect your eye from getting more damaged. So Imax, again, we formulated. I told you it really helped Callie. I was pleasantly surprised how quickly it did it. Not that I was surprised that it helped her, but how quickly it did it. And it really helped her to be able to get past it. And it really affects your life. You're not looking for glasses all the time. It's important. I can't guarantee everybody's going to have the same effect as my wife, but it contains the products contain essential elements that can help you to decrease the oxidation and decrease damage. Alpha lipoic acid, ginkgo biloba, carotenoids. We've got zinc, bilberry, quercetin, taurine. So remember, eyes to me are such an important part of your health. And number one, make sure you have a comprehensive eye exam when you turn 40. We don't think about that. The results will help you kind of have a benchmark to track any changes in the coming years. On average, see your eye doctor at least every 2-3 years. If you can, once a year, it would be great, especially if you hit your 50s. Once a year would be very, very important to do. And then remember, eye exams can also find, not just, we're talking about vision loss, but it can also find diseases like glaucoma. May not have any symptoms at all. It's very important to spot these diseases early on when they're easier to treat, right? Very important. If you have diabetes, it can lead to blindness. Important to control it and important to get your eyes checked. I've had family members that have lost their vision. It's no joke when you lose your vision. We literally use our eyes for everything, right? And it's frustrating to really try to function without adequate vision. Also very, very, frustrating to look for readers everywhere. And trying to figure out if you look at the ingredients and trying to figure out what it says. Very, very frustrating. So I think we owe it to ourselves to be able to do whatever we can to increase and enhance your eyes. So it's important to keep your eyes healthy by doing what? Eating the right way, maintaining a healthy weight, wearing protective eyewear, not smoking, managing your health conditions. And listen, consider a supplement like Dr. Nandi's Imax. We provide key antioxidant support for your eyes, supporting macular health, increasing the eye circulation. Very, very important. Again, want to make it as easy as possible. Give you 10% off your first order. If it's just the iMac, that's great. If it includes other other products that we have, absolutely love to do that. iMax made for you. So thank you for joining us today. Remember, your eyes are super important. Again, if you found this valuable, please share this with your community. We'll be back next Tuesday again with more information to really optimize your health. Remember, make healthy living a part of every day. Namaste.